I'm Dr. Ivey-OSullivan. Thanks for joining me today. So we're going to be discussing the dangers of opioid use and the tragedy that it is creating in our country and what we can do to get out of this situation that we're in. You've been hearing about it recently, the past couple of years, about how we are in an opioid crisis or an opioid epidemic, and it is the truth. We are in the middle of it, and this stuff hits home to me. Unfortunately, my little brother passed away several years ago now, and part of his deal was his drug dependency that he was involved in. Some of it was avoidable, and unfortunately, then it becomes unavoidable, as we're going to learn about here today. And so, even recently, I've had family members and friends of family members and friends of friends that have died and passed on from opioid overuse and opioid abuse and opioid, unfortunately, overdose. And I'm sure that you are in the same boat with me. And so I'm tired of that. I'm tired of people getting those phone calls that their loved ones passed away, due to an overdose. And so we want to do something about it. And so Dr. Rosa, who's a practitioner, doctor of chiropractic up in the Washington, D.C. area, he was on the Trump's opioid task force, and he has multiple clinics in the D.C. area where he provides alternative treatment in addition to traditional medical treatment for different pain syndromes, musculoskeletal, and etc. And he has put together this amazing information and has allowed other practitioners around the country to utilize it, and so that's why I'm doing this. So I give credit to Dr. Rosa. Everything that I'm going to say here today is actually, there's a bibliography to it. Okay, I can send you the slides. I can show you the information that Dr. Rosa's put together. So I'm not just making these numbers up and making these statistics up. They are real, and they are true, and they are sad. But then we're going to get into some good information about, hey, what do we do to change this? What do we do to change the trajectory of our nation and this epidemic that we're in? So let's get started. Opioids have been around for a long time. They were discovered, I guess the first records that we have of them would be the opium plant. Over 6,000 years ago, the Sumerians discovered it, and lots of good uses for it. Morphine in there gives pain relief. Codeine is going to help reduce pain, help with cough suppressant, kind of know that helps if there's a diuretic situation going on. Also papaverine, which is an antispasmodic chemical in that plant. Noscapine, and I'm going to be looking to the left a little bit because my notes are over here, so if you see my eyes wander, it's not because I'm trying to think of what I'm about to say, it's just I'm actually looking at the notes. Again, noscapine helping with cough, and thebaine, Thebaine, I think that's how you say it. As a chiropractor, as a doctor of chiropractic, we did take some pharmacology classes, but not a ton, as you can imagine, as we're most focused on natural healing. And so if I'm mispronouncing some of these, I apologize. And that is a chemical that's converted and used industrially. So a lot of great uses for this through the years, but unfortunately it has become certainly a situation where we've used it a little too much. So what is the crisis that we're talking about? In the United States, on a daily basis, we have about 500,000 opioid prescriptions that are given out. 4,000 start with non-medical use, 3,300 ER visits every day. 3,300 ER visits every day across the United States with opioid and pain reliever reactions. 200 people die of overdoses every day in our country due to opioids. That's starting to see more and more of those being synthetic in nature, like carfentanil, which we'll discuss a little bit later. 100 deaths a day are related to fentanyl. Just that alone, 100 deaths a day. Again, 200 die of opioid use every day. That could be something like heroin, or that could be a prescription opioid like Oxycontin or oxycodone or codeine. And then 90 babies are born every day addicted to opioids, which is certainly a tragic number to see. The United States, we have seen in 2020, we saw drug overdose deaths per 100,000. In 2020 was about 28.3 per 1,000. In South Carolina, we're higher than that. We're actually 33.1 deaths per 1,000 people in the state of South Carolina. So that's where I practice. That's where I've lived my whole life. And so that's sad to me to see that our nation is actually leading, one of the leading nations in the country in opioid deaths per 1,000. So During the COVID crisis and COVID epidemic, which I guess we're coming out of, some people say we're still in the middle of it. We may be in the middle of this thing for forever. Who knows? There were about 5,000 Medicare beneficiaries per month that suffered an opioid overdose. So that's terrible, right? So 5,000 Medicare beneficiaries per month were suffering opioid overdoses. That was the highest it had ever been. Between the years of 1999 and 2020, we saw a rise of opioid deaths in the United States go from 16,000 up to 92,000 in 2020, and then going past that and up into 2021, the total number comes out to be 100,306 opioid-related deaths in the United States. 100,000, and unfortunately, between 2019 and 2021, that number went from 72,000 to over 100,000. So we said almost a 40% increase just in 2 years in the number of opioid-related deaths. And so the question you're probably asking is why? Why in the world did we see such a rise in that 20-year period in opioid-related deaths? Why was there so much more rampant usage in the United States of those drugs, and particularly during the COVID crisis? Why do we see so much more of that drug usage ramped up? We're going to get into that in just a little bit. In 1997, so this is the total number of prescriptions filled by all Americans, including adults and children in the United States. Okay, in 1997, that was 2,416,000,000 and some change. By 2016, okay, so we're looking at a 19-year span right there, we had doubled. Okay, we went up from 2 billion prescriptions to 4 billion prescriptions. And that is just crazy town. Okay, it's actually more than doubled when you look at the total numbers right there. And so the thing is that the population of the United States had only increased by 21% during that 20 years. So our population only increased 21%, but then our drug usage went up from 2 billion prescriptions filled to 4 billion, almost 4.5 billion prescriptions in that time period. So what does that tell you? It tells me that we're too drug dependent in the United States. And certainly a lot of reasons for that. Prescription painkiller sales and opioid deaths are just completely related. If you look at like a curve of them on a graph, as the prescription pain pill have risen, then also the prescription pain pill or opioid related deaths have also increased in the United States over the past 20 years, which is super sad. So the CDC, okay, this is not some chiropractic group, right? This is the Centers of Disease Control. They did a study on initial opioid use, and what they found was that if someone uses it for just one day, so they take one pill for one day, that there's a 6% risk that they're going to be using that drug or some type of opioid a year later. There's a 2.9% risk of use of 3 years later. So 6% of the people, if they use it one day, will be using it a year later. About 3% of that population group will be using it 3 years later. If someone were to use it for 12 days, at 12 days, if they use an opioid for 12 days, they're going to be 24% likely that they're going to be using that a year later. And then if they use it for 21 days, then they're 35% of that population group was going to be using those drugs a year later. So you go in for, maybe procedure, medical or dental or something like that. You get an opioid, and these are your chances if you fill those prescriptions. So it's kind of scary. 30 days, use them for 30 days. There's a 43% chance that you're going to still be using those drugs a year later. So you use opioids for a month, there's a 43% chance, almost a 50% chance. So it's like the flip of a coin almost that you're going to be using those drugs a year later. So what do opioids do? Well, they do a lot of great stuff. I mean, my goodness gracious, you've got a family member or friend, or heaven forbid you, that's watching this, and you've got some kind of terminal cancer that's eating away at your bones, your liver, your kidneys, your spleen, your pancreas. And you're not going to make it. There's no more treatment for you. You're just in constant pain. Like, you want these drugs to work, okay? And they definitely have a place. You're on an awful car accident and you get some crushing injury to your leg or arm or what have you, or you're on the battlefield and you get an awful wound or a job work accident. Like, we need these drugs. I'm not saying they shouldn't be out there. My point is, in this whole episode is going to be that there's a use for them, and then there's a time where we should not be using them, and unfortunately we're giving them out a lot of times, most likely in times that they shouldn't necessarily be given out. Okay, and that's not me just saying this. I'm not a medical doctor. I can't tell you when you're supposed to take medication or not. That's between you and your MD. I'm just saying, in my opinion, it appears that based on the data that we're just giving them out too much. So, but again, there's a time and place for them, and they work wonders. So what do? Well, they bind to receptors in your brain, in your brain stem, even in your peripheral nerves. Peripheral nerves means the nerves kind of out in the periphery, not centrally in your brain or in your cord or in your brain stem, and they basically help you to suppress pain. So that's what they're supposed to do. They bind to the receptors in our brain stem, and they actually depress our breathing, okay, which is helpful if we're in a traumatic situation where our body could go into shock or become have too much carbon dioxide, not enough oxygen intake getting in. It could be a bad situation. So again, it's a great tool when we need it to work. I've seen family members that were at the end of their life and on hospice, and what do? They give them morphine. Why they give them morphine? Because they know there's nothing else they can do for them. They're trying to suppress their pain, and they're also slowing down their breathing to essentially allow them to die. So basically your body just continues to reduce its breathing rate until it quits breathing. The lungs just don't inflate anymore, the heart slows down, and the person passes away. So that is basically how most folks are dying when they're having opioid overdoses, is that they take the medication and makes them feel good for a bit, slows down their breathing until the point that they just quit breathing and they pass away. So that's how folks are dying. So again, great uses in traumatic and even life end of life stage treatment for certain conditions, and that's what it's doing to you. Now the challenge with that obviously is that you could overdose on it and die, but the other challenge is because of what it does to the other systems and organs of your body. Again, we talked about brain, it sedates it, also causes it to be in a depressed state. So that's a challenge, right? Because the more you take this stuff, you're actually going to start feeling less well overall, because you're going to be living in a depressed state because of what it's doing to the receptors in your brain and the changes that it's having on them. Again, we talked about it suppressing and depressing your respiratory system, reduces the effect of your immune system, so it makes you more likely and susceptible to illness and other injury, other sickness. Certainly can create liver system problems and liver damage. It's actually going to eventually, over time, and not too long a time, that's why folks end up staying on it for so long, is it actually damages your nervous system, and that it makes it more susceptible to pain. So what does that mean? That means is that since your body's not having to depend on its own pain gating mechanisms now, because it's thinking it's going to be getting this drug in to do that, then those receptors become more hypersensitive to pain. So you actually begin feeling pain at an increased rate. Like you stubbed your toe in the past, you might just walk it off. Now you stub your toe and man, it hurts like it's gotten cut off. So that's what it's doing to your body. So it actually makes you, again, more pain intolerant the longer that you take it, which is really great if you're a drug company trying to sell pain pills, because now folks have to take more and more and more in order to keep their pain levels reduced. So whereas before it might not have hurt you to go sit down on a couch or again to walk across your driveway barefoot, now you're not going to be able to do those things because your pain levels are going to be so high. You're going to have to be having those drugs in your body to keep that pain reduced, which is a terrible situation for someone to be in, because no one likes to hurt, right? No one likes to be in pain. Obviously, we know folks that have been on pain pills for long periods of time, what do? We see this a lot in our geriatric population. They're on these pain pills, but then they also have to be on like a stool softener, because it's going to slow down our body's ability to actually digest properly and eliminate food, causing episodes of constipation. So now we're starting to see, man, people are having to be on special diets and take other medications to fix this one medication that they're taking, and so that's certainly a problem there as well. My goodness, other thing, if you're taking anything like this, it's off the street, who knows really what you're getting. So how do we see and how do we recognize opioid dependence? Well, here's some things that you might look for in your family members or friends. How's their work and home or school life? Is it look like it's improving every day? Are they getting better and stronger, or do they seem to really be slacking? And are we seeing a reduction in their performance at home or at school, or even in their relationships? Are they having a loss of interest in their favorite activities? Are we starting to see some real changes in sleeping habits or their eating habits? Are you noticing that there's weight loss? Are we noticing that there's increase in irritability? Are they getting more angry? Are they getting angry easier than they used to? Maybe they've got a change in their social network. Folks that they didn't used to hang out with, and now you're starting to see them hang around some folks that seem to be kind of unsavory. Are they constantly feeling tired and sleepy? Are you noticing that? I mean, certainly there could be other things going on, but these are just some things to look for if you're expecting something. Are they having deteriorating relationships with their family, or with their friends, or with their loved ones, with their coworkers, maybe their teammates? And certainly, like we talked about before, is there a change in physical appearance to this person? Are you just noticing they're looking different, and they're looking more poor and they're and run down, so to say. When I say poor, I mean like frail, okay, as in not well, not talking about a socioeconomic status. What does this lead to? I mean, man, we know it leads to broken families, broken relationships, loss of job, can lead to incarceration. Unfortunately, we can see it lead to things like theft, and on down the line, to depression, to even we're seeing that this situation has led to folks selling themselves into sex trafficking or into sex slavery for the drugs, and it's just a horrible, horrible thing. And then eventually, it could lead to depression and to suicide, which we're seeing a lot of in our society right now as well. So what is this? Why is this a big deal? Well, obviously it's a big deal because we're losing loved ones. They're leaving our families, they're leaving our lives, and even just economically, they're leaving the workforce. Or they're just having a destructive tone on their work and their productivity. And so every year they're saying that we're seeing about a 700 billion negative effect on our national economy because of this opioid epidemic, which is not good. 20% decrease of the workforce over the past few years because of this opioid epidemic that we're in the middle of, and certainly, my goodness, cost of healthcare has gone up. Cost of having to have EMS workers and first responders to be alert because there's so many of these episodes that are happening throughout our state and throughout our country right now. So, and certainly it's having an effect even on our federal law enforcement as they're trying to get a handle on this. So, why did we get here? We talked about this before. Like, why have we seen such a huge increase in this since the late 1990s and into the 2000s? And if we go back, there was some production of these opioid drugs like OxyContin in the years past, in the late 80s and in the mid to early 90s, and the family that developed that drug, they got approved by the FDA. Their studies showed that there was no episodes of dependence that was created by use of those drugs, which now we know is completely fabricated study, unfortunately, based on the data that we have now. But that study got published and it went before Congress and it got approved. And interestingly, the Dr. Curtis Wright, who was the FDA examiner who approved the drug package insert for OxyContin, announced that the drug was actually safer than other rival painkillers. And so guess what started getting top billing for pain relief in medical doctors' offices and urgent care clinics and ERs across the country? OxyContin. And not only that, unfortunately, we saw soon after that, got approved, and OxyContin started kind of becoming big dog. That Dr. Wright, who worked for the FDA, left the FDA and went to work for the company that was producing OxyContin. So seems like maybe there was a little bit of collusion going on there. It just conjecture there. You can make up your own mind as to what was going on there. So at this point now, also the drug lobby pushed for another vital sign to be checked when folks go into their doctor's visits. So it's not only that we'll be checking height, weight, blood pressure. You're now also in kind of seeing, hey, how's the patient looking as well, just their overall countenance and whatnot. You had to be checking on their pain level. So someone could be going in for for their doctor to look at a skin issue that they have going on, and they have to ask now, what's your pain level? Well, it might be 0, but you have to ask. And so we're starting to put into doctors' minds that, hey, most people that are coming to see you probably have some kind of pain issue going on. And by the way, we have this very safe, okay, in air quotes, and effective pain relieving tool now called Oxycontin that's just come out that's actually, safer according to the literature than other painkillers based on what the FDA was saying. And so maybe you should prescribe that out. And so we started seeing a lot of prescriptions go across doctors' desks for these very addictive, as we know now, painkillers, which then unfortunately led to the epidemic eventually that we're in the middle of. Now, where does this affect the most? One of the worst areas that this epidemic is affecting is actually our veterans. Certainly, they have been through a lot and risked their lives for ours. They've put their lives on the line so that we can have freedom, and we need to take care of them. Unfortunately, what we're seeing in the veteran population is that they have some of the highest related opioid deaths and suicide rates among any other population that we examine, and that's awful, and that should not be. And so what we're seeing is that unfortunately the VA have been very complicit in the past with just recklessly prescribing these opioids for the veterans instead of maybe giving them other opportunities and other alternatives for other treatment. If you go to the VA, then you are 240% more likely to be described an opioid than if you were not a veteran and not going to the VA. 240% more likely. So what does that mean? I mean, that means that we're going to be having more of our veterans that are unfortunately overdosing on this stuff and that are becoming depressed, because that's what it does to the brain. And then certainly, again, like I said before, we see a high rate of suicide among our veterans too, which is tragic. And a lot of it's not, we know now it's not just PTSD type stuff. It's because a large population of our veterans are being recklessly put on to opioids, which is just leading them down in this downward spiral that they can't get out of. Well, thankfully now, the VA is starting to wake up, and so is the rest of the country, and they're starting to give, different type of alternative treatment than just prescribing opioids, thank goodness. So again, we're looking kind of at the reasons and what's going on here as well. If we look at the total amount of donations to the political system, and we've got this data from 1998 to 2017, and the pharmaceutical industry gave the most by far out of any specialty group to any lobby rather to the Congress, to your state reps, to your senators, to the political system. We're looking at those numbers, and between 1998 and 2017, the some annual donations. Okay, so annual donations would be $300 million annually, $300+ million annually given by the pharmaceutical industry, and that's way higher than other ones. The next highest one will be the insurance agency, just under $300 million a year. So by far, pharmaceuticals give way more money. If we want to look at it, even some other comparative things like we think about maybe gun control or gun rights. That it seems like they give a lot of money and have a large voice. If I'm looking at the data right here, we have gun rights activists give about $8 million a year annually to the political system. Gun control folks give about $1 million a year annually to the political system. And so comparatively, again, when you're looking at $300+ million given by the pharmaceutical industry to our politicians, who's going to have their ear more, right? I think we can see who it's going to be. Now, how does opioid dependence progress over time? Let's talk about that just a little bit. When you first go in and take that, man, it's good, right? It gives you relief. It actually makes you feel happy because you're out of pain. You're not going to be grumpy, right? And you're going to have this sense of euphoria, and that's where we get that initial thought of, man, this is good stuff. I probably need some more of this because I would like to continue to feel that way. And then again, it gives you some pain relief as well. But as we said before, over time, your body becomes more sensitized to pain because it's expecting this outside substance to come in and take care of it. So then you actually, over time, you start to be like more unhappy because your body is experiencing more pain, and you have to take this medicine to get you back to that state of less pain and happiness. And then that leads to, again, increased sensitivity to pain, which means that you're going to be hurting more and more over time. So what you went in and initially got some relief for, if you continue to use the stuff, as we said before, over 3 weeks or 4 weeks or 5 weeks or a year, now you're in a really bad state. You're going to be unhappy all the time. You're going to be dependent on this medication to keep you out of pain. And then you certainly are going to do a lot of other things that you might not want to, obviously, to get it. So what's the path from a prescription med that you probably needed for some surgical procedure or some type of pain situation that you were in to becoming, maybe addicted to heroin or some other drug? So Americans are prescribed opioids every day, okay, at an annual rate that could give Americans a 30-day supply. So let me restate that. Opioids are prescribed at an annual rate that could give every American a 30-day supply. So that's a lot of opioids that are being prescribed out there. Americans consume 90+% of the world's amount of opioid drugs, but we only have about 5% of the world's population. So obviously right there we can see there's an issue right there. And we're a very affluent society as well, so it's not like our folks don't have good health care access to other things. As the more that you use this stuff, the more that your tolerance increases, which means that you've got to keep taking more and more to get the same relief that you got this on the first day that you took it. That becomes a problem, so you're always going to have to be taking more and finding more ways to get it, which leads to a lot of other nefarious issues right there. So what does that mean? That means that folks, when their prescriptions run out and the medical doctors won't give them more, they start seeking, right? Going to different places. And certainly there's some great checks and balances now that are in place across the country to help those folks that are trying to bounce from doctor to doctor to get different opioid and pain-killing medications from having that to be the case or to have that happen. Problem is that them folks, because they need it, because their body just kind of has to have it now, like it needs oxygen to continue to live and thrive because of what it's doing to your brain, now they start looking to the street, and that's where we find folks getting addicted to things like heroin. And then now, as we hear about all the time in the media and the news, drugs like fentanyl and carfentanil, which are super dangerous. Those are synthetic opioids, so made in a lab, made from chemicals, not from necessarily just not made from the opioid or from the opium, the poppy plant. We're starting to see that these things can be produced in a lab, and they are a lot stronger and they're a lot cheaper to make. Okay, I mean, we think about that just going to the grocery store. It's a whole lot more expensive to buy the real food out of the section with fruits and vegetables and the organic vegetables and fruits and the organic meats than it is to buy the stuff out of a box that has a bunch of chemical names on it that you can't really pronounce or describe what they are. Those foods are a lot cheaper and than foods that are real. Same thing in the drug industry. It's a lot cheaper for folks to be able to make things like fentanyl and carfentanil, and they are a lot more effective. Okay, so they work a lot faster, they work a lot stronger, and they get people addicted a lot faster too, unfortunately. So fentanyl is 50 times stronger than heroin. Just gonna let that sink in a little bit. And it's 100 times stronger than morphine. Okay, so that is a very strong drug. Now, fentanyl, which is awful, and people are dying every day because of it, and because of the use of it, or because they don't even know that they're taking it, and they end up taking it, or they buy something that's got that laced in it just to give it a little kick, and then it kills them. Even stronger than that is carfentanil, and that is 100 times stronger than fentanyl. So carfentanil is 100 times stronger than fentanyl, and it's 5,000 times stronger than heroin, and 10,000 times stronger than morphine. So how long is it going to take you to get addicted to this stuff? Because it makes you feel so amazing when you take it. Well, if you live, it ain't going to take you long at all. But a lot of folks, unfortunately, are just not living through it. And that's a problem. Now, it takes about a month to be able to reset your body from the effectiveness of this stuff, which is a challenge because, that's a rough month for people. And then, unfortunately, if they relapse because their body's been reset, most of the times they think, okay, I'm going to go back to using the same amount I was using before I came into rehab, but their body's not ready to tolerate that amount, and then they die on that first usage. I've seen that happen, unfortunately, recently with friends and family members. This is a real tragic statistic, and it's the truth, okay? This is not made up data, right? Opioids are now the leading cause of death among Americans that are 50 years and younger. So opioids, the leading cause of death among Americans 50 years or younger. We got to do something about that. So how much is a fatal dose? Well, a fatal dose of fentanyl, if you think about looking at a penny, a fatal dose of fentanyl would be about the size of Abraham Lincoln's beard. Okay, if you just kind of took it and spread it over his beard, that's all it would take to kill somebody. Carfentanil, just think about Abraham Lincoln's nose. Just a few little drops right there. 0.02 milligrams of carfentanil will kill somebody. So as we see, it's not taking much to end folks' lives. And man, the profit margin is so much better. When you're looking at heroin, the profit margin right now on the streets is about $150,000 per kilo, $5 million profit per kilo for fentanyl. So what are the drug dealers going to go for? They're going to go for the thing that gives them the most profit because they're business people. They understand the math. It gets you addicted quicker and you make more money on it. So of course that's what they're going to do. This is a real crazy statistic right here. It's September 15th, 2021. This was an article about the CBP and Border Patrol fentanyl seizures at the southwest border of the United States. It says this year the CBP has seized a total of 9,337 pounds of fentanyl. Given the fact that 2 milligrams of fentanyl can be a deadly dose, that is enough to kill 2 billion plus people, more than 1/3 of the world's population. So that's what they seized at our southern border. Who knows how much actually got into the United States that wasn't seized. So we see it's a problem. We see the why it became a problem. We see, the pathway to addiction, which is sad and tragic, for a drug that has a purpose and it has a use, but when used inappropriately and given out at the wrong times, it really leads people down a path that they never wanted to go down. And for the most part, they just can't help it. And again, if you've never been addicted, then we don't want to pass judgment on folks that are, because we don't know what their struggles are and what they're going through if you haven't been down that path before. So what do we do? Like, where are a lot of these things given out? Well, a lot of them were given out, again, for procedures that, surgical, post-op, that kind of thing, major injuries in car accidents and workplace injuries or accidents, where there's been these awful crush injuries or dismemberment. And my goodness, thank goodness for those. And certainly, like we said, even in the life events. But a lot of times these things were given out, back in the early 90s and even until recently into the mid-2000s, where folks were going into their doctors and hospitals and ERs because they had some musculoskeletal complaint that was general in nature, that was not related to a pathology or any type of crush injury, and they were given this pain pill because stuff works. I mean, they come in with pain. So what can I do to get you out of pain as fast? Well, here, take this medicine. Again, given by doctors who had great intent to help their patient, unfortunately not understanding the long-term effects of these or even the short-term effects, because their data that they had been given was flawed and was basically made up. And so it's not that we're saying anybody did anything inappropriate in these doctors' office. We're just saying they were doing the best to their ability with the information given. Unfortunately, they were given information that wasn't accurate or complete or correct. And so that's kind of where we are now. So now we understand what the effects of these medications are for folks that don't necessarily need them. And so we're starting to see journals like the Annals of Internal Medicine saying, hey, here's some new guidelines about what the research has been saying for the last several years about options to treat things like musculoskeletal injuries, where people come into your doctor's office for. The second leading cause of visits to medical doctor's office in the United States is actually lower back pain. First reason for visit is GI complaints. Second reason is lower back pain. So medical doctors said, hey, what is the most effective treatment out there right now for things like lower back pain, since that's one of the main things that these medications were prescribed for. And now we have medical doctors, medical journals, the Annals of Internal Medicine here, the one I'm looking at, and this was April 4th, 2017. So again, goodness, 6 years ago almost now. They're saying, hey, go to the chiropractor. That's one of the recommendations that they give. I'm a chiropractor. I love seeing that in there. When I first started 20-something years ago, we didn't see this coming out of medical journals, but now we do. And I'm just going to read it. It says, recommendation number 1, given that most patients with acute or subacute low back pain improve over time regardless of treatment, clinicians and patients should select non-pharmacological treatment with superficial heat, moderate quality evidence, massage, acupuncture, or spinal manipulation. And it says if pharmacological treatment is desired, and it goes on to say some other stuff. So their recommendation is go get adjusted. Go to a chiropractor if you're coming in with lower back pain. And they're telling the medical doctors you should refer out to chiropractors, because we're seeing that there's a lot of evidence out there now that shows the effectiveness of it. Actually, the evidence has been out there for years. It's just now that it's not only chiropractors that are pushing it, other providers are starting to push it. So that's something that we could do for this. Recommendation number 2, this was 2B, also from the Annals of Internal Medicine. This is from August 18th of 2020. This says non-pharmacological management of acute back pain and lower back pain. And it says even non-lower back pain, so it could be middle back, upper back. It says look at doing things like musculoskeletal injuries will improve with acupressure, or reduce pain with improved physical function, which is what chiropractors do. We improve your physical function with adjustments or with different exercises or therapies or pressure points. And then it talks about doing things like electrical nerve stimulation to reduce pain, which is something that chiropractors use. A lot of chiropractors use things like electrical muscle stimulation to provide pain relief. And so what we're starting to see now, again, is that in order to curb this situation where we've got folks going in for pain complaints that could be treated naturally, we're starting to see that medicine is saying, hey, you need to go and try a natural treatment, because that's going to help you most likely based on the current research, versus just throwing pills at the situation, because that could lead to a lot of other problems for that patient, down the road or even in the short term. Even so much so that one of our major insurance carriers that is a provider of chiropractic services, they will give folks their first 3 visits to their chiropractor for free. So if a patient has like a co-insurance or a copay, then that's going to be waived by the insurance carrier for the first 3 visits to the chiropractor, because they know that if the person goes, the data is saying that they're going to get better in a shorter period of time, and it's going to actually cost the insurance company a lot less money for that person to start with the chiropractor than if they go any other medical route. And so they're encouraging folks, hey, give chiropractic a try, because the data is saying it's going to help you with your neck and with your back pain and with your headaches, with your sciatica, with your numbness tingling down your arms or legs, hands, and feet. So all the different kind of main things that we see in chiropractic offices. And so in summation, here's the thing. We're in the middle of not just one, epidemic, but 2. We've got the COVID thing that's been going on for a few years. Okay, I'm recording this in 2023 in January. We've been dealing with this, started hearing about this about 3 years ago in January of 2020. But we've also been in the middle of this opioid epidemic a lot longer, and it's taken out 100,000 lives a year of Americans that the vast majority of them don't need to be there. They don't need to be in that statistic. You think about an entire football stadium, right? I mean, my goodness, 100,000 people that are passing on too soon because they're getting hooked on these medications. And it's up to me and it's up to you to change that. So what do we do about it? Well, we've got to look for those risk factors that we talked about and those characteristic changes of our friends and loved ones. If you think and suspect that they might be having an issue, don't not go to them. You got to go to them and be forward and come to them with love and say, hey, it looks like I've noticed these situations and these things in your life. Is something going on? How can I help you? We've got to be proactive in looking out for our loved ones and our friends and family members and our coworkers and our teammates. And secondly, if you or someone that you know or love is having some issues and they're just wanting to go and get pills for that issue that's related to the things that we just talked about here, like back pain, neck pain, headaches, talk to them about going to a chiropractor. Find somebody in your community that your friends or family member go to that they love and they trust with their health care, and with their spine, and find the good chiropractors and go to them. We're in Spartanburg, South Carolina. If you're around, love for you to come see us. My office is Ivey-OSullivan Healthcare Services. We're in downtown Spartanburg, South Carolina, but there's other providers obviously all across the country that are great. They're taking great care of their patients. Just make sure that you find somebody that you trust, that your family and friends and coworkers trust, and go see that provider to hopefully not go down that path of getting addicted to these pain pills and to these opioids that are killing people by the thousands and thousands. So it's up to you, it's up to me. I appreciate your time and your attention. We hope this is going to make a difference, not only for your life, for your friends and family members, but for the lives of our country.